I'm really happy to see you.
Yeah, it's been a while.
Yeah, it's been like 4 years. We make a video with you, and it's very interesting to know what changed in your life. How did you spend these 4 years?
A lot has changed. I think we were talking about my AI company back then too, which
Yeah, it is.
that company now has grown to be valued at over $400 million. So
Cool.
that's been an interesting change.
Mhm,
Um, I've since stepped down from that company and been focusing more on education and
mhm,
mental health and helping other doctors with things that they're going through. So,
mhm.
yeah, a lot has changed.
Okay, so I think it will be very interesting if we will talk today about the mental health. Of
Yeah,
what did you mean by the term the dentist's mental health, and
yeah,
why did you decide to study this topic, to explore this topic?
yeah. Well, back in 2018, I came home and it was a dark and stormy night, and
Mhm,
it was about 7 p.m. I came home and went to go open my front door, and
mhm,
the deadbolt was on, so I couldn't open it. I knocked on the
mhm,
door. My wife opened the door. She was holding my son at the time, and she said, "Welcome home." And I said, "I can't do this anymore." And for me, that was dentistry. It had nothing to do with her or marriage or kids or anything, but it was dentistry. I was
uh-huh,
really stressed out, On the outside, I had everything. Was making good money. I was driving nice cars. I had a celebrity practice in Beverly Hills.
mhm,
I was speaking on the top podiums. I was publishing in the top journals, but I was really pretty miserable. I was having challenges with my team. I was having challenges with patients. My health was in a poor place. And I had to really just put dentistry above everything in my life.
mhm,
And so I knew I had to go on a journey, but I didn't know what it was. Now, because I'm a researcher, I went directly to publish research and started researching about mental health, the science of overachievers, evolutionary biology, the study of communication, soft skills, all the things that I never really learned, but I was really suffering with.
mhm,
And so I went on this journey and really helped myself, and my career took off. I started talking about this subject, and everybody asked me to help them too, because I realized there was a lot of people that were also suffering from the same things that I was going through.
mhm,
So I ended up creating resources for dentists, online courses, in-person courses, videos, social media stuff. And it's really been the most rewarding thing I've been able to do. So that's my story. That was
mhm.
why I ended up really delving deep into this topic of mental wellness for practitioners.
And what are the common mental health
Hmm.
challenges that
Yeah.
dentists may face in their profession?
Yeah, I think a big thing is just feeling inadequate,
Mhm,
feeling overwhelmed, feeling like they may have anxiety or depression,
mhm.
maybe even suicidal thoughts. Just recently we lost Frank Zastro to suicide, a famous,
Crazy.
successful, surgeon from Germany.
Mhm.
And you never really know what people are going through. But the more I talk to dentists from around the world, the more I realize we're all the same. We
Yeah.
all go through the same shit. Whether you're in Russia, whether you're in Brazil, whether you're in
Mhm,
Mexico or the UK or the United States, it's all the same stuff. Dentistry is really challenging. It's a very challenging job. It's a very rewarding job,
mhm,
but it's very challenging. I think the problems come from the fact that most of us only focus on our clinical skills. And that's really what we're taught in dental school is like just get better clinically and
mhm,
everything will be okay. And that's what I did and that's what most people do, but that's not the answer. The answer is we need to learn other soft skills like how to communicate, how to set expectations, how to set boundaries with people, how to have healthy habits outside of the practice, how to be a leader. That's some of the stuff that we never learn, but that's where most of us suffer.
Can you name some tips to prevent these problems with mental health?
Yeah, I think that the biggest tip is to separate your purpose in life from your profession. So if you are like me, you would have said things like, I was put on this earth to do dentistry. That's what I thought. And that sounds really nice, but the problem is things are going to go wrong in your profession. You're going to have a restoration that breaks. You're going to have an implant that fails. You're going to have a patient that's pissed off about something that doesn't want to pay the bill. And when those bad things happen, you take it on yourself as there's something wrong with you if you align your purpose with your profession. Now, you can still be passionate about dentistry. You can still love dentistry, but you have to know that it needs to be put in its place. It's what you do for work. It's what you do for a job to make money. So that's probably the biggest change that someone can make is just a mindset shift of I'm not just a dentist. I'm a person that happens to do dentistry for my job. Now, there's a bunch of other tips that you can do outside of the profession as well so that you can show up better. I call it the dream sequence. So you have diet, relationships, exercise, appreciation, meditation, and sleep. These are all research-backed ways that you can show up, be less reactive, be more well-rested, and just be ready to go through the challenging times that are in dentistry. The other tips would be to set the right expectations with patients and with team members. I think a lot of us in dentistry are people pleasers. We will do whatever it takes to please somebody.
Yeah.
And that gets us in trouble. Ask me how I know, because you do whatever it takes to get something done, and you may not be setting the right expectations for people. So that was one thing I had to learn how to do, was to set boundaries and set expectations with patients, with team members, with my family. And that really served me well over time.
Or how can I change my mindset?
Good question. It starts with awareness, though. First, having awareness that maybe you have the wrong mindset, right? And then it's not something that happens in a day. Sometimes it may take months or even a year to change this mindset, but just having this awareness and think, maybe I shouldn't align everything that's important to me in dentistry because it's bound to fail. Dentistry is bound to fail eventually, right?
Yeah.
I mean, very rarely does something last an entire lifetime, especially with how long people are living now. So it's a bad practice to align your purpose in life with your profession. That's in any profession, not only in dentistry, but especially in dentistry because of the fact that it's so challenging.
And how I can understand how to diagnose that I have some problems with mental health in the early stages.
Yeah, that's a hard one. Again, awareness is the first step. So like if someone's watching this video, or if they follow me on Instagram, or they follow other positive kind of psychology people, you have to have that awareness, because for me, I didn't even know I was going to a dark place. I wasn't there. I didn't know I was there until I had to make a change. And my goal is to stop people as they're just starting to go down, and then they can come back up. They don't have to come crash all the way like I did, right? So, you start to think like, am I having negative emotions? And that's step one. And that's probably the most important step, is just the awareness. Once you have the awareness, here, let me change my Wi-Fi to be wired.
Sure.
Okay. Once you have the awareness, it's much easier to know when you're going down maybe the wrong path.
Mhm.
But it's all about that awareness. And so you have to just be focused on that. Self-awareness, realizing there may be a problem. Now, unfortunately, what I find is that most people don't make a change until they have to. Like me, I was
Mhm.
either going to quit
Mhm.
or I was going to get better. Those are my options.
Mhm.
So I wish more people could figure out something maybe changing, make some little changes, and then go on with their life. But I don't see that too often.
At what age mental health problems are most often?
It's a good question. I tend to see it most between about 5 to 15 years out of dental
Mhm.
school.
Mhm.
So that's different for where you live, right? Because, in the US, we do 4 years of college. So we usually don't graduate dental school until we're at least, 26. But, everywhere else in the world, people are graduating around 22.
Yes.
So, yeah, it's about 5 to 15 years out of dental school is where I see most mental health challenges happening.
Mhm.
And what's interesting with that is when you're 5 years out, you're pretty good clinically. You're not
Mhm.
struggling clinically anymore. So it's like because the last 5 years we've spent all of our time and money and effort on getting better clinically,
Yes.
we finally hit that and
Mhm.
realize, oh shit, there's more things that I should have been focusing on. It's like you become a bodybuilder that only works out their biceps and never does their legs or their back or their.
Mhm.
So that's kind of how most of us dentists are, is we're a one-trick pony. We do one thing well, and that is clinical dentistry. And we suffer because of all the other things.
What methods help dentists to manage with stress and the emotional strain at work?
The question is, what's the message?
No, what methods?
Oh, what methods?
Yes, what
Yeah,
methods
so
helps
yeah.
dentists to
Mhm.
manage with stress?
Yeah, good question. There's multiple methods.
Mhm.
I think a big one is what I call self-mastery. So self-mastery is understanding your emotions and being able to choose how you react. Now,
Mhm.
that is easier said than done. And like I said, with anything, that is a skill. It's something that if you put time and effort and money into, you can get better. So let me give you an example. The patient comes in and you just did, I don't know, veneers. They come back a week later and they say, I hate how they look. The bite doesn't fit. Your immediate reaction may be, well, gosh, you approved it last week.
Mhm.
You approved the provisionals. You approved it when I put it in. Like, what changed? You're such an idiot. Oh my gosh, I put in all this work. But with self-mastery, you may be feeling that, but you may not act on it. So you feel it. You have the thought of, what is the best way for me to react in this specific case to continue this relationship? And then you react like that. I mean, that is probably the biggest thing. It's something that one of my friends, Martin Mendelsohn, calls living between the stimulus and the response. When I was in my darkest point, the stimulus and the response happened at the same time.
Mhm.
Something happened, boom, I reacted. Now, a lot of that was because I wasn't in a great physical shape. I wasn't sleeping well, I wasn't eating well, I wasn't exercising. So I came into the situation not even ready for that. If you have self-mastery, you can decide how you respond, which is a superpower. Now, besides that, we have things like meditation, breathing, having a greater purpose. Those are some of the methods. There's also methods within your practice to reduce stress. Setting expectations is one of them. being very good about setting expectations with your patients, setting expectations with your team members, being a better leader, doing more predictable dentistry. This is like one area where clinical dentistry can reduce stress. Things like doing guided surgery, learning how to do biomimetic dentistry so that you can bond better. You don't have sensitivity, you don't have D-bonds. So being more predictable clinically can reduce your stress to a certain point.
Mhm.
So there's a ton of methods that are helpful in this. Some are within the practice,
Mhm.
some are outside of the practice.
Mhm. So let's talk about the methods that are outside the practice.
So that's the acronym is DREAMS for me. Diet, relationships, exercise, appreciation or gratitude, meditation, and sleep. I think probably the two most important ones for showing up are sleep and uh, uh, sleep and exercise
Mhm.
are probably the two most important ones. I was one of these people that said, I'll sleep when I'm dead. I'm gonna stay up and learn more.
Uh-huh.
I'm gonna stay up late. I'm gonna wake up early. And I mean, we have all the research that if you're not sleeping well, you're not going to show up in a great position. You're going to be more reactive. You're going to get sick more. You're going to, not look as great.
Mhm.
Like all of that impacts stress in the practice. And so just doing some things outside of the practice so that you can show up well is so important. I like to relate dentists to professional athletes. So you think about the average professional athlete, they have to perform at a high level, just like we do.
Mhm.
But they have to perform at a high level maybe 2 hours a day, maybe 3 hours a day, maybe. We have to perform at a high level 8 hours a day, measuring in microns.
Mhm.
Now, when you look at the daily habits of a professional athlete, they are eating incredibly well. They're exercising, they're meditating, they're connecting with family, they're having appreciation. Like they have coaches on all of this. When you look at the average dentist daily habit, they're eating fast food, they're not drinking water, they're drinking alcohol, they're, sleep 5 hours a night. I mean, they treat themselves like shit and then they wonder why they feel so bad.
Mhm.
And I really think that we perform at an extremely high level. We need to treat ourselves like a professional athlete.
So you named so many things, yeah,
Yes.
to do outside the
Yeah.
the dentistry,
Mhm.
but I think that the main stress is how to find time for all these
To make it a
activities.
priority, right? I mean,
Yes.
most of the time is there. Don't go on your phone as much. Don't waste time when you're outside of the practice.
Mhm.
When I say exercise, the research shows you only need to do 45 minutes 3 times a week. I can tell you every dentist I know can take 45 minutes off of their phone when they get home to go to the gym. You have the time. Listen, I have 2 little kids. I run multiple businesses. I have the time. And I still sleep 8 hours a night.
Mhm.
So you're going to eat anyways. Just make sure you eat something healthy, right? A lot of times it's not doing more, it's doing less. Everyone thinks you have to, okay, well, gosh, I'm working 10 hours a day and I don't have time to then work out and
Mhm.
meditate and all this stuff. Well, then work 9 hours a day, work 8 hours a day, take a day off. A lot of people think that doing more is the answer, and many times it's doing less. We've had many people that have gone through my programs that go from working 5 days a week to working 3 days a week and making more money
Mhm.
working 3 days a week. What
Oh.
you realize is that working 5 days a week at low efficiency
Uh-huh.
is not as good as working 3 days a week at high efficiency. Working 3 days a week when you're rested, relaxed, little things like case acceptance goes up because you're rested, you're feeling good, you're not stressed. Little things like dismissing patients, dismissing problem patients.
Mhm.
You know, we keep so many problem patients around for so long,
Yeah,
and
sure.
they just rot our practices from the inside out. And when you get rid of those people, everyone that's there is so appreciative and happy. Then your team is happier. They work better. They work more efficiently. You're
Mhm.
happier. You work better. You're more efficiently. The general vibe of the practice is better. And this is how you can take a practice that goes from 5 days a week to 4 days a week and either makes the same amount of money at 4 days a week or makes more money at 4 days a week.
Mm.
Because it's all these little things that add up to it.
I think that a lot of dentists are so afraid that they will make less money.
That's true. Yeah, I
And
mean, I was afraid of that too. When I started taking more time off, I
uh-huh.
did make less money. And guess what? I was happier. I made less money
Uh-huh.
and I was happier because I had more time off. I was finally rested. I was exercising. I was eating right. I was way happier. Now, that ended up coming back. But at first, when I took a day off, yes, I made less money or even the same.
Mhm.
But wouldn't everyone like to work less and make the same? I actually haven't found a doctor yet that I've worked with that takes a day off and doesn't make the same or more. I haven't found one yet. I know it sounds crazy, but
Yes.
I've seen it time and time again.
Mhm. Okay.
Because
Can
your
you?
team may be suffering from burnout as well. Your
Yeah,
team may need some time off too.
I think yes. We don't think about this when
No.
we work like 5 days, 6 days, 7 days a week.
You also have no
We
time to
only work.
manage the practice too,
Yeah,
because
sure,
most of us
sure.
run our own businesses.
Mhm.
We're too busy working in the business and we don't have time to work on the business.
Yes.
And when you, like, I've had dentists that go from 5 days a week clinically to 4 days a week clinically, but one day that is administrative or that is leadership or that is management.
Mhm.
And their practice grows, even though they're doing less clinical dentistry because they're finally organized, setting expectations, their treatment plans are better, they're working with the better lab. I mean, all of this comes together to add more fuel to the fire.
How is your dental practice
My
looks like
practice is going really
now?
well.
Uh-huh.
Yeah, my practice is going really well. I retired from clinical practice this
Oh,
year.
wow.
I'm still a partial owner of the practice.
Mhm.
So my partner Matt Najad is there. My other partner, Dr. Mark Helm, is there too. So they're still full time, but I have retired this year.
I think that's cool. And how old are
I
you?
feel like I can help more people by helping the dentist instead of helping
Uh-huh.
the patient.
Yeah. And how old are you right now?
I'm 41.
So you retired at 41, right?
Yes. I'm
Uh-huh.
still working, but I'm not working clinically
Yeah,
anymore,
yeah,
right?
yeah,
So,
yeah.
I'm still working on other businesses. I still advise tech companies. I'm still
Mm-hmm.
speaking.
Mm-hmm.
But yeah, I've just shifted my focus away from the clinical side
Mm-hmm.
to the business side to the education side.
Let's talk about your education for dentists.
Yeah, so I have a few different ways of doing it. I have
Okay.
online courses.
Mm-hmm.
I have masterminds. So those are like meeting twice a month on Zoom. We have dentists from all over the world. It's kind of
Mm-hmm.
like a support group a little bit
Mm-hmm.
for dentists to just be open and honest about things that are going on in their practice, whether it's mental health or practice management. And then I also do in-person courses as well for mental health with one of my partners, Martin Mendelson. So we do 2-day in-person workshops that are like really, really transformational, really exciting stuff. So that's where I am from the education side on mental health
Mm-hmm.
is many different ways. Online courses, in-person courses, and then remote mastermind support groups.
What advice can you give to dental students to improve their mental health when they are students?
Yeah, I mean, if you can do a lot of the stuff I talked about when you're a student, you'll set yourself up to have a really great long career.
Mm-hmm.
So the main thing is that mindset. If they can get that mindset that dentistry is cool, dentistry is fun, dentistry is my job, but it's not who I am, that is probably the main thing I can tell them.
Mm-hmm.
The next advice that I would give would be don't focus only on clinical dentistry. Yes, you need to be good clinically. You have to have good hand skills. You have to be proficient in clinical dentistry. But getting your margins from 30 microns to 20 microns is not going to make a big difference. However, learning how to communicate well with your patients, your team, your family, learning how to set expectations, learning how to set boundaries, that will take you really, really far, and you will really excel in your career.
Maybe you can name some books for
Yeah, so there's
dentists
multiple
to read.
books. Yes, I
Like
mean,
top 5, maybe top 10.
probably the most important one I would say would be Crucial Conversations.
Mm-hmm.
So that's one that gives you a framework on how to have crucial conversations or these difficult conversations, right? So let's say you have a team member that's constantly late. How are you going to talk to them? You have a patient that never wants to do your treatment plans and doesn't want to pay for x-rays and doesn't want to pay for exams. How are you going to have these conversations? That's probably my number one book. Another one that I would recommend is by Matthew Walker called Why We Sleep.
Mm-hmm.
It completely changed my life to prioritize sleep. And that was a huge one. There's another book called Good to Great. I'm trying to think of some of the other ones that I really like. Can't think of the other ones right now, but maybe those three are good.
What are some signs that a dentist may need a professional mental health help? Some signs
Yeah,
for
that's
my
challenging.
colleagues,
I would
maybe.
say, yeah, if you are, I mean, if you're having suicidal thoughts, for sure, see a professional. If you feel like you're crying a lot, you may have depression.
Mm-hmm.
I don't think there's anything bad that comes out of seeing a mental health professional at all. So even if you're not at the low, low, low,
Mm-hmm.
it can be still very helpful to go to therapy, to see a psychologist. Um, I've found that I don't think I've ever had someone come to me and say, I went to see a therapist and it was really bad. Most most of the time, even if the therapist isn't great, it's still a big value add to have a professional that is a third party that has no bias towards you or what you're doing.
Mm-hmm.
I would also add that having conversations with like-minded people that understand what you're going through is a huge value add. And that was really why I started my community. Because I had people that would talk to their spouse or their neighbor or their brother or sister or parents who aren't dentists.
Mm-hmm.
And unless you're a dentist, you don't understand what it's like that we go through. Everybody thinks our job is easy. Oh, we just kind of do this and we make good money and you're a doctor. They don't know the shit that we go through every
Yeah.
day and exactly how challenging it is.
Yeah.
So when I started being more outspoken about it, I had so many dentists that just said, finally, someone's
Mm-hmm.
talking about this and understands what I'm going through.
Mm-hmm.
And just having someone understand you is really important because I thought I was the only one going through it. And so when I started talking with other colleagues to realize that, wow, I'm not the only one, it made me feel good about myself. Don't align your purpose in life with your profession.
Okay.
Don't focus only on clinical dentistry.
Mm-hmm.
Learn soft skills, learn how to communicate, how to set expectations, how to set boundaries, and you'll be able to have a long, successful career
Mm-hmm.
if you do that. But you have to make an effort. Just like anything, if you put time and money and effort into something, you'll get better at it. Remember when you prepped your first crown? It was horrible. And that's exactly how soft skills are. Learning how to communicate is the same way. Learning how to set expectations, learning how to set boundaries. All of those are skills. Even like meditation is a skill. Exercising is a skill. Diet is a skill. Having appreciation is a skill. But you have to put time and money and effort into it, and then it will get better.
Thank you so much for these very useful tips. I was very happy to see you 4 years later. And I see that you are so happy, you know,
I am. Yeah.
that you
Things have
live
really changed for
your
me.
best life. So I wish you good luck and best wishes for you.
Yeah, let's do it again in another 4 years.
Yeah, sure.
Thanks, Dimitri. Yeah, really,
So
really nice talking to you.